You're listening to the Journey podcast. Is conventional medicine missing the forest for the trees? Get all the details in today's episode. Hi, I'm Petra Brunbauer, and with decades of experience with sadness, pain, anxiety, and stress, I finally figured out how to leave all that behind. And this podcast shows you how to break free permanently so you can reclaim your sanity and find the self-esteem and energy to go after the life you desire. With real talk about mental health, holistic healing, and the tough journey of coming out the other end. This is the Journey Podcast. Welcome to today's episode. In this episode, we explore functional medicine, a whole body approach that aims to identify and address the root causes of health issues. Our guest, a passionate functional medicine practitioner, shares insights into how functional medicine differs from conventional healthcare and why it could be a game changer for many patients. Dr. Ashley Shrader, DNP, is a board-certified family nurse practitioner and IFM-certified practitioner. Prior to functional medicine, Ashley worked in various conventional healthcare settings, which revealed the algorithmic and impersonal nature of the traditional healthcare model that leaves many patients overlooked and disempowered. Dissatisfied with this approach, she pursued continuing education with the Institute for Functional Medicine, a rigorous and intensive certification program which emphasizes treating the whole person and the root causes of their symptoms. Ashley has a passion for gut and hormone health, especially as they relate to brain and mental health. As a registered yoga teacher, Ashley believes that mental, emotional, and spiritual health are the foundation for the path of healing. Her career in healthcare reflects her own personal health and wellness journey, which includes getting diagnosed with autoimmune disease and learning that she has a genetic predisposition to developing ALS or Lou Gehrig's disease. Let's meet Dr. Ashley Shrader. Hi, Ashley. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you because functional medicine, a root cause approach to healing, is such an amazing topic for today's conversation. I feel like we can all do with a bit more root cause investigation when it comes to our own health. So thank you for coming on today and chatting with us. It's a pleasure to have you here today. Welcome to the podcast.
Thank you so much. I'm so excited to be here.
Yeah, me too. I think that's a great topic to dive into and maybe one that's becoming a bit more popular, but especially here in Europe, I don't see functional medicine sort of as a mainstream access yet. So excited to talk about that. And for starters, would you like to share a little bit about yourself and your story? What inspired you to do what you do and maybe give our listeners a bit of an idea what you do?
Yeah, sure. It's kind of been a long road to get here. My initial career in my 20s, I started as a consultant. I worked in finance and real estate investment, completely different world. I felt really disconnected from the impact that I was having. I was thinking, okay, I'm going to have this like higher level, big impact on the world. And it wasn't suiting my nature, who I am and what I'm meant to be doing. I found out about yoga, started teaching yoga, I started teaching yoga in a shelter and really felt drawn to that and noticing that like one-on-one impact that you can have with somebody and how powerful that is. So much more powerful than like a desk job. And so I was figuring out what I wanted to do. I ended up in a bike accident one day in Washington, D.C., where I was living at the time. I flew a car, like opened their door in the bike lane. I flipped over the car door, ended up in the emergency room. First time ever for me going through the experience of being like very vulnerable in our healthcare system. And so just every single person from the paramedics to the PA in the hospital, the doctors, the nurses, everybody was just so caring. And I just felt so safe at such a vulnerable point in time for myself. And so after that experience, I was like, this is where it is. Like you can be with people in their most vulnerable time and really have such a powerful impact. And so that's kind of what got me started on this path, this journey. one point, as I was transitioning careers into becoming a nurse practitioner, I developed an autoimmune disease, Hashimoto's, and my doctor's recommendation was, here's a pill, you can take this for the rest of your life. And I was just so like dissatisfied with that. I could not believe that. Why would somebody in their 20s have an autoimmune disease? Why aren't we asking more about what went wrong to get me here? And so that's when I started to dig in a little bit more into other paths in healthcare. That's when I learned about functional medicine, and it was just eye-opening. There was so much that was going on in my life, in my lifestyle, nutrition, that was like laying the groundwork for developing this autoimmune disease. And it wasn't until I addressed all that, even though I was on the pill, it wasn't until I addressed all that my symptoms actual of hypothyroidism, Hashimoto's resolved. And so just having that experience in my own personal health journey was like, okay, you've got to share this with other people. This is powerful.
Yeah. Thank you so much for sharing that story and just explaining about your autoimmune and the path that took. It just highlights for me one of the gaps that's very apparent in today's healthcare system in many, many countries across the world is that there's just medication thrown at a lot of things without investigating what is actually going on. And part and parcel of that, of course, is time limits on the personnel that's available and budgeting limits. So there's a few things that come together for the perfect storm. But what you have actually gone into now is a little bit different than a regular doctor would do, for example, in their office. So what is it that you do now, and how is that different from what you experienced at the time?
Yeah, sure. So I've worked also in like a conventional primary care setting. And I know from experience, because I participated in this as a patient and a provider, that the goal is to get the patient a diagnostic label. So you want to slap a label on them, and then you want to follow the algorithm until you get them the medication that they need. Of course, there are other modalities that are considered, but typically that is what's medical school, nurse practitioner school, that's what they're teaching you. Slap the label on, get them the medication, get them out. It's the most efficient way to get a patient in and out within 10 minutes in a safe way, and also to be able to address their symptoms. There are other systemic factors at play, pharmaceutical companies, insurance companies. There's just so much pressure on the system. And so that's why the model looks the way that it does and why we have so many sick people. Where functional medicine really shines is addressing chronic symptoms. So folks with chronic fatigue, fibromyalgia, hormonal dysfunction, gastrointestinal issues like IBS, that system with like the diagnosis and the medication for many people does not address their symptoms effectively, and nor, of course, does it address the root cause of the symptoms. So with that approach, they're never going to heal. They're never going to heal. And so I think there's been an awakening among patients, and the demand is changing, and patients want more. They want to understand why they're getting sick, and they're motivated to do something about it. And so with functional medicine and my approach and the way that I practice, we're taking more time, we're doing more labs, we're really investigating all potential contributing factors, mediators, and we're addressing the entire life, right? So their trauma, their history, their stress, their diet, nutrition, all of it, in addition to figuring out what's happening in like a biochemical way.
I like that. And you're touching on something really important. And then that is that very often part of what happens to us when we experience physical symptoms is something that we may not be able to actually see in a lab test. It could be in the setting of our lives, it could be in our lifestyle, and something that's maybe not measurable precisely in a lab. So, of course, when someone that you see in a doctor's office runs a test and it's not obvious what's going on with you, it makes it infinitely more difficult to give that diagnostic label that we're looking for in the medical system. So I like the idea that you go beyond that. And are there patients or clients that you work with where you look outside the lab tests and you kind of see a lot of other things going on? You mentioned trauma. Of course, trauma might not be something we can test for in a lab test, right? Chronic stress, we can maybe with stress hormone levels, but there are also contributors to stress that we might not be able to see in a lab test. So how much of what you do actually comes out of your client's life versus just strictly being a medical test? And is that a big thing that the medical system is missing out on nowadays?
So true. Yeah. And you're so right. Like to like layer on to what you were speaking to before too. When patients are told that their labs are normal, but they feel a different way, it's traumatic for them. It's a denial of their experience. They're told that they're okay, that this is in their head, and then they're sent home. And that just can really exacerbate the entire process in terms of the way that their symptoms are manifesting. And so for that reason, a lot of my patients, by the time they get to me, they have been told this time and time again, you're normal. They've been to all these specialists. You're fine. This is in your head. No, just lose weight. Like that's a classic. And so pretty much all of my patients, who does, we all have some degree of trauma, of stress. It's so important. Another big contributing factor too is having purpose, like really feeling aligned with what you're doing in life and what your role is in this life. I think with all of those things, if there is some sort of imbalance or deficiency or something's missing, that really ultimately at the end of the day is the root cause, right? Like, there certainly can be like toxic exposure, chemical exposure, of course, but really at the end of the day, a lot of this is going down to those very deep roots, which are usually psychosocial or spiritual.
Yeah. And how do you measure that in a lab test and give someone an answer?
That's a great question.
You know?
You don't. Exactly. And so you just you have to address it. You have to talk about it, and then you have to create a plan for it, right? So if you talk to somebody and they're like, I'm lost, I have no purpose, I don't know what I'm doing here. One of the things that I do is make sure that I'm connected to really great referral partners who can address issues like this. So the right therapist for the right issues, or healer, depending on what it is, the issue that's going on. But having a really good referral network is also so key, because you can't do it all yourself.
Yeah, absolutely. I love the idea of that kind of co-working together with other practitioners, which very often gets overlooked in a medical setting as well, as the collaboration with other people who have expertise in different areas where you might be able to refer someone outside the medical setting as well. So that's really, really important. And one of the things that you work with, in addition to the functional medicine or as part of the functional medicine, is the nervous system. And that is also obviously not something that really gets addressed when we just give out medication to people. So how does the nervous system factor into the work that you do? And how do you see that impacting your clients when you're working with them? Is there a large part of people who come to you where you definitely need to do nervous system work? Is that part of a lot of different things that you come across? Or how does the nervous system figure into what you do?
Such a good question. I think we all need some degree of nervous system work. I think our nervous systems are bombarded with information, stimulation every day. And without that, I think inevitably that will cause some issues down the road, no matter what. So we all need it to some degree. A lot of that work really, in terms of what I'm prescribing for somebody, depends upon where they are mentally, like what they're open to. I work with a lot of folks in the Washington, D.C. area. And so a lot of them just aren't really ready. They need like a lot of evidence before moving on to something that's a little bit more conceptual. So I'll start somebody like that with like some breath work, like something simple like that. And I can point to some evidence. And it's pretty much with all of this, you can point to evidence, but I think really there's like a readiness factor. And so I really assess where somebody is before giving them something like that. Some of the more powerful modalities that I use that I will talk to patients about and kind of guide them through is like tapping. I don't know if you've heard of like emotional freedom technique, such a wonderful tool to use. I use it myself all of the time. And then something that I also use quite frequently in folks that have been struggling for a really long time with chronic symptoms, and it's clear there's some nervous system dysfunction, is limbic system retraining. So it's pretty amazing. It's using neuroplasticity to rewire the way that the amygdala, like the fear center in the brain, communicates with the nervous system. So it's ultimately getting at that path. That is what is really driving a lot of that disease or that dysfunction there, that in communication. And so if we can get to how that amygdala is talking to the nervous system and rewire pathways in the brain, that ultimately will change the manifestation of a lot of these symptoms, which can be traced back to the nervous system. And so a lot of that is, it's kind of like a program. There are a few different programs that I use that I'll actually kind of refer patients to that are like 15 minutes a day. It's a lot of like visualization. There's some like actual, like kind of touching yourself, calming yourself techniques. And it's so powerful. People with chronic like diseases that typically are really hard to get improve. Chronic Lyme, fibromyalgia, histamine disorders, they'll get better with this approach. Like this is the missing link for them because you can do so much with replacing nutrient deficiencies and healing the gut. But if we don't address the nervous system, which is what you were alluding to, then that patient is never going to heal.
Yeah, and that's fascinating because there are so many, I would say, challenges, illnesses, diseases that actually come back to these nervous system components because people have experienced a lot of trauma or chronic stress. And these are the components that don't really get addressed. And so we have maybe a temporary improvement in what's going on with medication or things like that, but we're not actually helping anyone heal the root cause. So I love that about functional medicine, and what you do is to actually give people this avenue to heal, not just to put a Band-Aid on it, but to find healing in their challenges and what they're going through. And that actually brings me to something I was thinking about when you were talking, because this approach that you offer, I feel like this is very, very empowering for your clients because they actually get listened to. They get to tell you, look, I've had a million lab tests. I've been told there's nothing wrong with me, but I know inside that something is going on. And you're potentially the first person they come to that takes them seriously on that. So how is this approach different from a regular medical system approach as far as giving clients that empowerment back about their own health and their advocacy for their own health?
You're so right. I think the healing starts when the patient finally is experiencing that empathy and that somebody actually believes them, that believes that their symptoms are real and that believes that there is truly something going on that needs to be addressed. And so, that's every single patient that I see. The reason why they're there to see me is because they've had these run-ins with our healthcare system that have just left them feeling disempowered. And so that's one of my favorite aspects to this. And I think that's where in my practice, this is where what I feel like I'm completely aligned with what I'm meant to be doing, is just being there, present with somebody and listening to them. Like that's a therapy all in itself. And so I think when also somebody knows that they're able to talk about their symptoms in a safe place, they'll intuitively start to understand more about what's contributing to their process. And so they actually start to become their own healer because they're finally able to start reflecting and tapping into their intuition. And so it just makes it so much more easier for them to take control of that process too.
Yeah, absolutely. I think if you're told for a long time that there's nothing wrong with you and you're just making it up, basically, you start believing that and you start doubting what you're actually experiencing. And many of the women, especially that I talk to, have expressed to me that they felt like crazy people because they kept looking, they kept going back and saying, I can feel that something is not right. I know you've done all these tests, but something is going on. And they weren't being taken seriously. And so that was part of when they came to functional medicine, was really that reconnection to their own intuition and their own trust in their bodies, that reconnection with their bodies to really find out what was going on with them. So in addition to this physical component, obviously if people are experiencing physical symptoms, that is sort of a glaring signal that something's not right, but are there also mental and emotional components that are being addressed in functional medicine that we might be not really looking at in a traditional setting that you address as a functional medicine practitioner?
Certainly. It starts from the intake form. The intake questionnaire for most functional practitioners is asking about childhood. We're getting back to birth. Like we really understand what were the dynamics in childhood. Also, in addition, the lab work actually can be really helpful on this part too, because our neurotransmitter production and balance, and the same with hormone production and balance, is so dependent upon what our nutrition status is. And so we really can, if we get a good assessment of nutrition and also of what's happening in their body, like where the nutrient deficiencies are, or what's happening with the gut health. We have great tests now that can evaluate the health of like the microbiome. Then we can really start to address some of the biochemical contributing factors to the symptoms that the patient has had, the emotional and psychological symptoms that the patient is having. So it's like a multifactorial approach. We want to understand everything from birth till now, and then also what's happening in the body too.
Yeah. And I love that whole body, that whole person approach where we're not just singling out the one thing that we can very obviously see, and that is a physical symptom, but you're going beyond that. You're interconnecting everything, the whole person from start to finish, and you're trying to figure out what they're experiencing in their own lives. So what a revolutionary and really, really great approach to someone's health and to their healing path. So tell us a little bit about the kind of things that you see in your practice. What do clients usually come to you with? What are some of the big challenges that people are experiencing when they've had their port of call in the healthcare system? They've been driven absolutely crazy because there's things that aren't being resolved. What is it that they're coming to you with?
Yeah. So almost everybody has some degree of depression or anxiety that's kind of bound up with some of these other physical symptoms. Most of what I see is like perimenopausal women. So they are experiencing some fluctuating hormones. They're in their 30s, 40s. And usually there's some stressor on top of that that's kind of pushed things over the edge, whether that's a work related stressor or something that's happening at home. They can no longer compensate. The other piece that's typically also wrapped up in this is gut health. So a lot of my patients have had IBS their entire lives. And because the gut, the microbiome is so important for how we metabolize our hormones, when we start to see those fluctuating hormones as really high levels of estrogen and perimenopause, and if our microbiome is not built to metabolize that, due to lots of different things can contribute to that, then the hormonal symptoms will become exacerbated. And so we'll just see kind of this feed forward effect, and they're not feeling resilient to stress. A stressor comes along, maybe it's not a huge stressor, but then it just pushes things over the edge. Most of my patients are burnt out. I have had a lot of patients this year on disability because they just can't, they're too tired or too much brain fog, too much anxiety. They can't even function. And so, and the good for them for knowing they need to take the time to really focus on their health too. Yeah.
Yeah, absolutely. Unfortunately, I feel like this is on the rise, these symptoms of burnout, of brain fog, of feeling exhausted all the time, maybe even the chronic fatigue that you had mentioned in the beginning. And I'm not sure if that is a sign of what's going on in the world around us, or if just, especially as women, we're being asked to do many, many more things than we used to. We have careers, families to take care of, household. We are supposed to get an education, make money. So there's a lot of things that go into that used to just be a very straightforward, you take care of the children. That is what you do. And of course, that adds a lot of pressure to women, and you throw the hormones in there and everything tends to go crazy. So yeah, that is very interesting. And do you see a lot of that on the rise as well, more than you used to in this, especially for women?
Oh, yeah. Oh, for sure. It's been, I'd say some of the factors that are contributing to it are just like what you mentioned. So women are all taking care of kids, but they're also working full time. And so there's just so society expects that of them, but then society doesn't expect the self-care. And so that's just what gets like, we just don't build it in. And we have to, or I mean, anybody is susceptible to the stresses of just modern day life. And so, yeah, I mean, it's definitely been on the rise. It's been worsening. And I think there's so many factors that are going into it. And you've identified the big ones for sure. Yeah.
Yeah, challenging times, I feel like, on many different levels for us. And also a really good time, though, to turn to offerings like what you offer in a more comprehensive way to address our own health and to advocate for where we should be going with our health. So let our listeners know a little bit about what you offer. How can they connect with you? What kind of things can they work with you on? Do you have programs or sessions that you offer? Let us know a little bit about that.
Yeah. So my love is working with patients directly. So you can learn more about my offerings on my website. But what I'll typically do is start with a strategy session. It's a 30-minute session where we kind of talk about symptoms and really try to understand how we can work together. No matter what, after that session, I'm going to outline a plan for you, whether or not we work together. I'm going to outline a plan for things to consider for next steps. Like I was saying before, I have a wonderful referral network. And so I'm always looking to get somebody to where they need to go, whether it's with me or not. And then typically after that session, I will order some labs if we're moving forward to work together. And we'll do a real comprehensive functional medicine visit where we spend 90 minutes talking about history, looking at some of these initial labs, talking about what they mean, and kind of collaborating on a plan that does cover those aspects that we were discussing before: the emotional, the stress, the nervous system, nutrition, and then, of course, anything else that's going on as it relates to labs and other pathologies we think might be going on. So, yeah, that's how you can work with me. I work one-on-one with my patients, and I provide a lot of support in between visits. And I would love to connect with folks on social media as well. I'm active on Instagram and LinkedIn.
Amazing. And is this for US residents only, or can you also work with people outside the US if they've, for example, had labs done or anything like that?
Right now, it's US only. I am figuring out how to work internationally with folks, but for right now, just with the licensing issues, it's US. Yeah.
Amazing. Thank you so much for all this wonderful work that you do. And we will, of course, be linking to all of Ashley's offerings in the show notes as well. So be sure to check there on how you can reach her website, how you can connect with her one-on-one, and how you can find her on the socials. And if you have any comments or questions, be sure to send those through. And we'd love to chat with you about your take on functional medicine and have you tried it and what has been your experience. We'd love to know more. And if you haven't, then this might be a really good opportunity if you are living in the US to connect up with Ashley and find out your own path to healing, your own challenges, and how you can advocate for your own health. Well, this has been another incredible episode, and I really hope our listeners have enjoyed our journey into functional medicine today. It has been so exciting having you on the show today, and you have so much wisdom and knowledge in this field, and I really appreciate you sharing that with us today. So thank you very much for coming on today, Ashley.
Thank you so much, Petra. I love talking about this, and it's been so fun chatting with you, and thank you.
Thank you, Ashley. Take care.
Thank you, too.
Thank you so much for taking time out of your day to listen in. If you enjoy the Journey podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Journey on Facebook, Instagram, TikTok, and our website, thejourney.com. Sending you love and courage, and see you next time.